morning everyone. In today's topic, I would like to discuss to you regarding National Polio Eradication Program. So before starting into the problem, I want to discuss you regarding what is this poliomyelitis. Just I want to give you some brief introduction regarding the topic poliomyelitis. So as you all know, poliomyelitis, it is an intestinal infection and it is a acute viral infection which is caused by the RNA virus. Primarily, it is affecting the human alimentary tract and the virus gradually develop and it will enter into the central nervous system, which is resulting in various degrees of paralysis, and it can possibly cause death also. So coming to this poliomyelitis, it is mainly occurring in the children who are under 5 years of age, and 1 in 200 infection leads to irreversible paralysis. And here if you see, the cases of wild poliomyelitis, they had been decreased since 1998. So in the year 1998, there were about 3,50,000 cases which were reported, but in the year 2018, only 33 cases were reported. So there was a tremendous modification which had occurred in the disease poliomyelitis. So due to the measures which was implemented by the governments of India, the government of India, the polio had come down in such a way that it was eradicated completely. And if you see here, in March 2014, 27th, this WHO World Health Organization, it declared India as a polio free country because there were no cases of wild polio were reported in the past 5 years. In order to achieve this, as India as a polio free country, the government of India has taken lot of measure to implement this program and lot of measure to make India free from the poliomyelitis disease. So we are going to discuss in detail regarding the topic in our National Polio Eradication Program topic. Coming to the topic here, vaccination against this polio, it was started in the year 1978 with expanded program on immunization, and by the year 1999 it covered around 60% of infants by giving 3 doses of oral polio vaccine. And in the year 1985, the Universal Immunization Program, it was launched in the country India to cover all the districts. So UIP, Universal Immunization Program, it has become a part of Child Survival and Safe Motherhood Program in the year 1992 and the Reproductive Child Health Program in the year 1997. So if you see here, the number of cases of this polio has been declined from thousands during 1987 to 42 in the year 2010. If you see in the earlier slide, you can see here how many cases are there. There are nearly 3,50,000 cases. But in the year 2018, there were only 33 cases which were reported. So this is the tremendous achievement which had been occurred during the polio eradication program. So following in the year 1995, global polio eradication initiative, it was taken by the World Health Organization, and India launched pulse polio immunization program with the universal immunization program, which is aimed at 100% coverage. So they want to coverage total population, mainly the children who are below 5 years of age. You can see here the last reported cases of wild polio in India were in West Bengal, Gujarat, which was occurred in the year 2011, January 13. So polio is among the group of diseases which can be eradicated. So polio, it can be eradicated because it affects only the humans and there is no known animal reservoir. And if you see here, compared to the other diseases, the vaccine which is present for the disease is very effective. The polio vaccine, it is very effective, and the vaccine is also very inexpensive. So everybody can afford, and moreover it is a free program which is completely given by the government of India. And if a person is taking oral polio vaccine continuously for 3 doses, means in an accurate base, correctly, if the person is taking the 3 doses, the immunity, it will last for lifelong, and the virus, it can only survive for a short period of time in the environment. So coming to the strategies which were used in the polio eradication. So if you see, polio is not only a disease which is pertaining to the only country India, it is present all over the world, and it was a global problem when it had occurred. So there are different countries in the world which were suffering due to the poliomyelitis. So every country has their own strategies, and and all of them had followed several key strategies which helped them in eradicating the disease poliomyelitis. So I'm going to discuss one by one regarding the strategies which were implemented. Coming to the first one, routine immunization. So by maintaining the high levels of coverage, so they want to cover as much as possible. At least they are aiming at 100% of population coverage, mainly 100% of coverage to the children who were below 0 to 5 years of age, So how many doses were given? Mainly 3 doses of oral polio vaccine were given, that is from 0 to 1 years of age group. So first one is routine immunization, second one is supplementary immunization activities. So simultaneous administration of oral polio vaccine to all children who are at the age group of 0 to 5 years, and that is from 4 to 6 weeks apart to interrupt wild polio virus transmission and to increase immunity against the children. So mainly the supplementary immunization activities, they are mainly focusing on the children who are at the age group of 0 to 5 years of age. So interval, that is about 4 to 6 weeks apart, they want to give the polio vaccine so that they interrupt the transmission and increase the immunity of the children against this disease poliomyelitis. Supplementary immunization activities, they are including, what are they including? National immunization days. The entire country is covered here, and the other one that they are including is sub-national immunization days, where some states or the parts are they covered. So if you take the national immunization state, entire the country is being covered. If you take sub-national immunization state, only some states and some parts of the states are being covered here, and mop-ups are conducted as soon as possible after identification of the virus as a game strategy to interrupt transmission when the virus transmission is focalized and polio cases are found in specific areas. So the basic aim of conducting the supplementary immunization activities is to reach all under 5 children with potent vaccine in each round. Mainly they want to achieve covering all the under 5 children, mainly all the eligible children has to be covered by this immunization activity. So mainly this is by offering immunization to all children at booths on the first day, and if somebody is missing the dose, they will go for house to house immunization. What is this what is the statement is saying? Mainly they want to cover all the children at booths. First of all, at polio booths they want to bring all the children and they want to provide immunization at the first day. By chance if somebody is missing, then they will go for house to house immunization. They will go for house to house immunization. Mainly the immunized children in transit streams deployed throughout the duration of booth and house to house immunization activity. Next one is surveillance and investigation of cases of acute flaccid paralysis. Mainly they want to do the surveillance so that the data will be used to identify the areas which were under this wild polio virus, and the transmission of the virus can be decreased by proper immunization activities, and polio can be eradicated if the recommended strategies are implemented effectively. Whenever you find out a polio virus, if you follow these strategies like routine immunization and supplementary immunization activities, if you are able to cover the maximum coverage of children who are under 5 years of age, and if you come to know that in a particular area if there is any new case which is occurring, wild polio virus case, then if you follow the key strategies, you can definitely eradicate the disease poliomyelitis. So the strategy which is now being promoted by WHO and the government of India has the following silent features. So simultaneous administration of vaccine, oral administration of vaccine, and covering 100% of children who are below 5 years of age. If you see here, whenever all the children are being vaccinated at the same time, if you are able to vaccinate the children at the same time, the polio virus which is present in the intestines of these children, they will be replaced by non-disease causing harmless virus. So if almost all the children are replaced with the non-disease causing harmless virus, the disease can be eradicated, because the polio virus which is present in the environment, it cannot survive for long time. long time. So these were the silent features and silent strategies which were followed by the WHO and government of India in the program for eradication of poliomyelitis. So coming to the oral vaccine here, if you see, oral vaccination is best suited for ending the crippling disease because it is easy to administer, it is very cheap, and it reaches the intestine directly and prevents the multiplication of disease causing polio virus. And it will, what it will do is, it will replace the disease causing polio virus into non disease causing polio virus. There is a chance when the vaccine gets flushed out of the child with the stool, it may spread to other children also. So the children who were not immunized, there is a chance for getting infection to those children who were not immunized. So what they have done, so they have conducted pulse polio immunization for every 2 days every year for 3 to 4 years until the polio had been eradicated, and they have sustained high level of routine immunization and monitor oral polio vaccine coverage at district level and below has been implemented. And they have improved the surveillance capability so that there will be detection of all polio cases that has been identified, and they have ensured rapid case investigation, which is including the collection of stool samples, arrange follow-up of all cases of paralytic polio at 60 days for checkup of residual paralysis, and they have conducted outbreak control cases and they have confirmed or suspected to stop the transmission. And pulse polio program, it has been begun in the year 9th December 1995 when it reached 8 crore 78 lakh children all over the India. And if you see, under this program, all the children under 5 years are given 2 doses of oral polio vaccine in December and in January until the polio has been eradicated. And if you take the objective here, the main objective is to cover all the population, all the children who were below 5 years of age, 100% coverage. And coming to the aim here, so they want to reach the unreached children, through improved social mobilization, and they want to plan mop-up operations in areas where the polio virus has been almost disappeared, and they want to maintain high levels of morale among the publics. So in the year 1995, the eradication activities has been introduced. So before that, before the introduction of this polio eradication activities, there was like more number of cases which are being registered. But after the introduction of this polio eradication activities, if you see, there was a tremendous progress which has made. So India is recording the lowest levels of polio virus transmission ever, and is poised completely to interrupt the transmission in the very near future. Mainly they want to interruption of the transmission of the disease. So the more the activities has been established, the more the children are getting free from the polio virus disease. Since it cannot live outside the body and it can live only in the children there, if you are able to vaccinate each and every children, then we can eradicate the disease very easily. So coming to the topic here, from the beginning of the polio eradication initiative, India has been the world's longest polio endemic count before the introduction of National Immunization Day in the year 1995. So before this polio eradication strategies were implemented in India, India has registered the world's longest polio endemic count. So that is every year, if you take the annually, there were like 35,000 paralyzed children which were mainly causing due to the disease polio. So in order to decrease those number of counts, there were significant reduction in cases were seen mainly as a result of implementation of this National Immunization Day in the following years. So after the implementation of this National Immunization Day, the annual count of the patients, it had been declined in a tremendous manner. So if you see, before the introduction of this National Immunization Day, how many cases were reported? There were nearly 35,000 cases were paralyzed due to the polio in India. But after the introduction, that count has been decreased tremendously. So, but in the coming to the year 2002, suddenly there was a major outbreak, that is in the western UP. And like 1,000 cases were reported, and Because of this major outbreak, the adjacent states, mainly the states which are around the western Uttar Pradesh, these other states are also got infected. So these states they remained almost free from 1 year from the disease poliomyelitis. But in the year 2002, there were nearly 1,000 cases which were reported, and it had spread to the other states also, which had been free from polio more than 1 year. So by the partnership of India under the leadership of Government of India, it mounted an appropriate response to the outbreak. So because of the number of supplemental immunization activities that had been increased, and the improvements made in Asia quality and community acceptance of this vaccine through enhanced social mobilization and efforts, which were including special underserved strategy for the areas of western UP, the disease had been controlled. So the outbreak was controlled and the disease was curtailed in just 2 years, from 1600 cases to 159 districts in 2002 to 134 cases in 44 districts in 2004. So what happened? Because of this supplemental immunization activities, so they have increased and they have improved the quality also. So mainly they focused on the areas, underserved areas of measures. They had given us a tremendous report again. So from in the year 2002, in 159 districts, there were like 1600 cases. But in the year 2004, it was the disease itself pertained to only 44 districts, and we have seen only 134 cases. And the program has continued to build these achievements and also introduced the monovalent polio vaccine, which is also known as MOPV, which has further reduced the number of polio cases to 66 in 2002. So out of the 62 cases which were reported in the year 2002, like Bihar was reporting 30 cases, and western UP it was recording 29 cases, and Jharkhand reported 2 cases, Delhi reported 1 case, Uttaranchal 1 case, Punjab 1 case, and Haryana 1 case, and Gujarat 1 case each. So out of 66 cases of polio which were recorded in the year 2005, so this was the statistics. So although no cases were detected, but the areas of Mumbai and Thane, when they have taken the sewage samples, they have detected the presence of mild polio virus, which has been genetically linked to the virus which is present in the Bihar. So this was the lowest number of polio cases ever detected in a year in a country. And there has been a continuous reduction in type 3 polio virus cases, and which is now almost eliminated, decreasing the disease from 22 cases in the year 2003 to 7 in 2004 and 4 in 2005, all in a localized area in western UP. So if you take in the year 2002, there were about 1600 cases in 159 districts of UP. The same state it recorded only 22 cases, and in 2004 it recorded only 7 cases, and in 2005 it recorded only 4 cases. So in Delhi, from an average of 900 cases annually from 1994 to 1995, only 5 cases of polio were reported by the year 2008, and in the year 2009 there was nil cases, no cases were reported. So in the year 1994 to 1995, what are the average cases in Delhi? Like 900 cases used to report, but in the year 2008 only 5 cases were reported. Only 5 cases were reported, and in the year 2009 and 2010 and 2011, so far there were no cases that were reported in the state Delhi. If you take the count in the national wide, so in the year 1995 to 1996, the average cases of this poliomyelitis were like 50,000. If you consider it in the year 2007, the average cases per an year was about 874, and in the year 2009 the average cases were about 741. But in the year 2010 only 42 cases have been reported, and in the year 2011 only 1 case was reported all over the country. Coming to the steps which were incorporated in the goal of polio eradication program, first one is maximum reaching the maximum number of children. Second one is house to house activity, and third one is exception from the government departments, and next one is using the pulse polio booths, and the next one is message to the public. So first we will discuss regarding the reaching maximum number of children. So they want to reach the number of maximum children, that is of below 5 years of age, through National Immunization Day or simultaneous National Immunization Days. So mainly by booth approach. So there is a total of 7,900 pulse polio booths that were planned in a state, and they were spread over the assemblies which were including Delhi Medical Association, they're including Indian Academy of Pediatrics, and booths at transient points such as like ISBT and the national railway stations, metro stations, interstate borders and entertain centers. So they have planned the pulse polio booths in these areas, and these booths will be mainly maintained by a doctor or a nurse, and the staff will be on an average of 3 to 4 members. Next one is house to house activity. If any person, if any child by chance is missing the booth administration of polio vaccine, then on the subsequently over the next 4 to 6 days, the teams of health workers, they will move from house to house and ensure that every single child that is up to 5 years of age has received the polio doses, and ensure the quality coverage through house to house search and immunize activity training of the staff, supervision and effective monitoring at each level is being planned. Even in-house search and immune activity has been instituted in health institutions, hospitals as in previous years. So expectation from the government departments. So if you see what are all the expectations that has been on the government departments here. So the employees who are working in the government departments, they are advised to reach their own areas and they has to participate in the pulse polio booth. So the pulse polio will begin at 8 a.m. in the morning, and these government employees who are working in various departments, they has to help in mobilizing the children to the booths in National Immunization Day, and they have to incorporate with the local group, housing societies, political workers, parents in a good spirit, and employees could also help by providing their own personal vehicular support to the medical officer to the booth if and when needed in a given extant situation on the pulse polio day. Next one is using the pulse polio booths. So you have to use this pulse polio booth to educate the parents on routine immunization and why it is important. So all infants below 1 year are supposed to be receiving the birth dose of oral polio vaccine, that is called 0 dose, followed by 3 doses at 6, 10 and 14 weeks of age alongside of diphtheria, pertussis and tetanus vaccine, DPT vaccine. And next one is they have to take the first booster dose of oral polio vaccine at the age of 1.5 years along with the DPT, and followed with second booster dose at the age of 4.5 years to 5 years along with this DT vaccine. And now it has been proved conclusively that pulse polio doses are complementary to the routine doses and are not a substitute to routine polio vaccine. Coming to the message to public here, the sick and newborn children, they should be given oral polio drops, and the drops are in addition to routine immunization doses, and these drops are completely safe and they are of highest quality, and repeated doses provide additional protection. And routine polio vaccine, it is given at birth, which is called as 0 dose, and it is given at 6th week, 10th week and 14th weeks of age, and polio eradication effort will continue till we achieve the goal of polio eradication program. So thanks for listening. So as I said in the earlier slide, polio was completely eradicated in India, and WHO declared India as a polio free country, and till now these are the effective measures which were taken in the eradication. Thanks so much for watching. Please, if you like the content, you can subscribe the channel and you can share it to your friends also. And if you have any queries regarding the topic, or if you want to give me any kind of suggestions, you can post them in the comment box. Thank you so much.